Well, this week is Hepatitis Awareness Week. And here to talk about the infection is Dr. Jason Ellison with St. Alphonsus. Dr. Ellison, thanks for being here today. Appreciate it. So first of all, just, what is hepatitis and what are some of the symptoms that people might show?
Sure. The general definition is just hepatitis means you have inflammation in the liver. And a lot of things can cause that. And so because of that, the symptoms can also be really general. You can start out just with like symptoms you'd see at a regular infection, right? Diarrhea, vomiting, loss of appetite, fever. Those are some of the general symptoms. But what really gives hepatitis away usually is you're going to have some very focal pain in the right upper quadrant and then turning yellow or jaundice in your skin or even the whites of your eyes. And that's kind of a dead giveaway that the liver is inflamed.
And so there are different types of hepatitis. We hear hepatitis A, B, right?
Absolutely, yeah. In fact, hepatitis has a variety of causes. It could be anything from an autoimmune disease to something you're born with congenitally. But the kind that I think we're focusing on this week is more what you're referring to, the viral hepatitis causes like A, B, C, D, and E. It goes all the way up. And so the viral ones are the ones that I think we need to be most aware of and try to know what the risks are out there.
So how are they contagious then?
Yeah, you bet. Well, hepatitis A is just simply kind of like any other foodborne pathogen. It gets on food, it gets on your hands, it gets in your mouth and goes through your GI system and will affect your liver. That one's temporary. It's what we call an acute illness, right? It affects you, it runs through your system, you're done with it, no long-term problems with hepatitis A. It sometimes can cause really severe liver damage. It's pretty rare, but again, it's only in the acute setting. The ones that are chronic that are scary are hepatitis B and C. Those are really the ones to think about. Hepatitis B is the one that doesn't have any cure. It is more prevalent than hepatitis C. Hepatitis C, actually, we do have treatments now that can get rid of it 90% of the time, so it's pretty curable at this point. But hepatitis B is the one that is not curable, and so we got to try to prevent it.
How are they spread? Well,
so hepatitis B and C are just spread by it's a bloodborne pathogen. So just like HIV, it has spread from one person's blood getting in contact with another person's mucous membranes. So it can be spread through, IV drug sharing, drug use, sexual activity. Blood transfusions are no longer an issue because the screening process is so good, you can't really get it that way anymore. But through blood contact is the way. Infants being born to moms that have hepatitis B or C, that's a major form of transmission, especially in countries where it's at risk.
Does hepatitis present differently in different groups, whether, men, women, children, or different races or anything like that, or is it pretty consistent?
Oh, good question. No, it's pretty consistent. It can present differently among people, but it's not different among children or adults. It's pretty much, you have this initial illness where you get sick, and you might not even realize you're getting it because it's just your typical ill symptoms, right? Fever, fatigue, stuff like that. But then the effects it has on your liver is you start having more chronic fatigue and start looking yellow. And these viruses in particular can become latent, so you might not even know you have it. It just goes dormant in your body and it can reactivate later.
Yeah, I'm pretty sure I know the answer to this question, but if someone even has a suspicion that they might have hepatitis, go see the doctor.
Yeah, that's exactly right. And you don't have to see a GI specialist or a gastrointestinal specialist. You can just see your primary doctor, and there's some very basic lab tests to do to see if you have those viruses.
Okay, easily detectable then.
Yes, very much so.
All right. Dr. Ellison, thank you so much for being here today.
My pleasure.
Appreciate your time on this Hepatitis Awareness Week. Absolutely. And we'll be right back.